Hey, my name is Jennifer Hawkins. I'm a college student at Gordon State College in the BSN program, and I wanted to take a few minutes to talk to you about HIV. HIV is a virus that damages the immune system. After you first get infected, you may see some signs of like flu-like symptoms, and then they usually subside, and then you probably won't see any other symptoms for possibly even years. Eventually, you'll start losing weight. You'll just be really tired. You may have swollen glands, night sweats, fever, just fevers that won't go away. This is usually what brings people in, and they eventually find the diagnosis of HIV. So HIV is very preventable. That's the most important thing to do, is know that you should try and reduce your risk for getting HIV any way possible. And the number one way you can do that is simply to not have sex. That's going to reduce your risk for HIV to almost nothing. If you are sexually active, then it's very important that you protect yourself. Every time you have intercourse, any kind of sex, whether it's oral sex, whether it's vaginal, anal, you must use a brand new latex condom each and every time that you have intercourse. So this is going to be your next best way of protecting yourself from HIV. The condom sometimes can break, so that's why this is not always 100% safe, but it usually is a very good way to keep from getting it. Another way that people contract HIV is from sharing needles. So this would apply to your drug users who shoot up things like heroin. A lot of times these shared needles end up sharing HIV from person to person. So HIV is going to spread through bodily contact. We've got vaginal secretions, you've got anal secretions, and you've got like blood. Those are your ways that it's going to spread. So it's just very important that you protect yourself from those things to lower your risk. The best way that you can find out whether or not you have AIDS is to get tested. And it's really important that you use your resources that are available to you to learn more about this. You can come to your local health department and find everything you need to know about preventing HIV and protection. They even have condoms available for you to use for free. You can have your testing done here as well. You can also find testing options available at your doctor's office. They sell test kits even at Walmart, and you can mail them in, and then you'll get your test results back. Sometimes at the health department or your local clinics, they can even do some rapid testing that'll give you results very quickly. Over 1 million people in the United States have HIV, and 1 out of every 7 of those people don't even know they're infected. So that is why it is really important to make sure that you're tested often if you're in the at-risk category of being a drug user or sexually active with multiple partners that you don't protect yourself from. If you are a female, it is very important that you get tested for HIV often, because if you were to get pregnant and have a baby, then without the proper treatment, you will pass HIV on to your unborn baby through delivery. Whether it's C-section or vaginal, you're risking your child contracting HIV. So if you are seeing your doctor and you're making your monthly appointments, and you're taking your medication properly, then you can definitely have a safe delivery without transmitting HIV to your baby. HIV does pass through bodily secretions, including breast milk, so the CDC recommends that you not breastfeed if you are HIV positive. Even if your viral load seems to be 0 or low, they still recommend that you not breastfeed your child. So you really need to educate yourself, go to the clinic, go to the health department, go to your doctor, and have them involved so that you can take the best care of your baby. It's very important after your baby's born that it see the pediatrician, and it has its well visits so that they can make certain that your child remains HIV free. I just will wrap this up by saying that the most important thing that you can do is just protect yourself. You need to manage the fact that you are at risk for it, then you need to go and you need to protect yourself. If you do contract HIV, it's okay and you can live a normal life. It's just that you will need to see your doctor, you will need to stay on your medication, and you'll have to take your medication the rest of your life. So if you want to remain symptom free, that's the best way to do it. There are examples of people like Magic Johnson who have had HIV for years and they remain symptom free because they take their medications like they should. These medications can be expensive. However, sliding fees at the health department and with the government's insurance, you can be able to take your medication and it not be as expensive. So that's why it's important that you go and see your doctor and take care of yourself. So, all right, that wraps it up, and thank you for your time.